It's been 5 days since the health minister ordered for the immediate reopening of the Kolebu Teaching Hospital and its renal dialysis unit, especially to outpatients. But Joy News is learning that the facility remains shut. We're live at the Kolebu Teaching Hospital, where the Public Relations Department is expected to brief the press on what exactly is holding them back. But first, though, let's bring back a report filed by parliamentary correspondent Kwaku Asante because the issue came up on the floor of Parliament last Thursday.
A frantic appeal to the Kolebu Teaching Hospital to reopen the OPD of its renal unit to save lives. Already, the Renal Patients Association says a dozen of their colleagues have died following their inability to access healthcare services. According to Minority Spokesperson on Health, Kwabena Minta Kando, government must intervene to get the facility reopened immediately.
Parliament as a whole should be deeply concerned about the persistent closure of the renal unit outpatient department at Kolebu Teaching Hospital. This situation has far-reaching implications for the well-being of dialysis patients in Ghana and raises serious questions about the commitment of government to transparency and accountability in our healthcare institutions. In the initial case of the facility's closure was attributed to scarcity of essential medical consumables required for dialysis. When dialysis medical consumables were finally procured, the service saw an unprecedented increase in fees from 380 Ghana cedis to 765.42. The Minister of Health and the hospital administration must, as a matter of priority, address this situation. The denial of essential healthcare services is a severe violation of patients' rights and a breach of public trust. We implore the government to work diligently with the hospital to rectify this situation and uphold its commitment to providing accessible and affordable healthcare service to all citizens. The paramount objective must be the prompt reopening of the renal unit outpatient department and the provision of essential subsidies to ensure that healthcare services are accessible and affordable for all citizens.
This call has found support from the majority leadership.
I fully associate myself with the call for the minister to be programmed to appear. That is something we cannot compromise on. He must appear. And especially on the matter about the lives of our citizenry, we can't take for granted. It can happen to any of us. And so I'm fully associated with that call. It's about the lives of our people. Whatever it takes, he must appear. We must program him to appear and to brief us. Immediately, the Kolebu Renal Unit should be open immediately. And there are some other actions that have been taken. That is why I'm emphasizing the call. And Speaker, we need you to bless this call that the minister should be programmed to come and make this statement formally on the floor of Parliament. He can't sit in his ministry and engage the media and make this statement. He must come to the representative of the people and make this statement formally in the House.
The Speaker has since summoned Health Minister Kwaku Asante to appear before MPs on this urgent matter.
To come and brief us on the closure of the renal unit outpatient department and the upsurge of kidney-related problems in Ghana. I mean, the minister should come and tell us something. Almost everywhere, people are talking about the kidney-related problems. He should come and tell us if the NHIS issue can also be captured in relating to kidney-related issues. I mean, he should come and tell us and to the extent the whole nation. So that is my directives.
The Renal Patients Association says its members and other kidney patients are dying, and more will die if government does not impress upon the Kolebu Teaching Hospital to reopen the outpatient department of the renal unit of the hospital. This matter has become a big matter on the floor, and in a rare show of bipartisan unity, MPs on both sides have been asking the health minister to intervene and get this unit at the Kolebu Teaching Hospital open. MPs say that while citizens must do their best to protect themselves of kidney diseases, those who already have contracted such diseases must be protected by the state. Reporting for Joy News, Kweku Asante, Parliament House, Accra.
And of course, our latest checks are indicating that still that outpatients department is not open in spite of the directives given by the health minister. So what exactly is going on and what's the latest on the ground? Let's go live now and speak to my colleague Fred Adai-Kwarting, who's been to the hospital facility. He's joining us now with the latest on this. And Fred, we're expecting a statement from the Public Relations Department on this matter. What else have we been picking up? You've been to the facility today. What can you report?
So, Lizard, I've been here at the KBTH Renal Unit trying to witness the reopening of the unit to OPD, but unfortunately, that has not happened as we speak yet. I've tried to get some answers from the authorities, and what I'm picking is that there is an attempt or there is a plan to open the unit today, but because the plan has not been approved yet, because the person who is supposed to approve the plan hasn't given the go-ahead yet, the place has still not been opened. But they are saying that until the person in charge opens or gives the approval for the unit to be opened, they can't open as we speak now. So that's why we are still here waiting that maybe the person in charge might come and give the approval for the unit to be opened.
You say it's closed. We know that there was a directive from the health minister. So what's accounting for that delay?
Okay, so we've been trying to get these reasons why the place has still not been opened up per the directive given by the health ministry. But it seems all the officials I'm trying to speak to are tight-lipped. They are not able to pinpoint the exact reasons. But when I put my ears on the ground and I am listening to some of the conversations going around, it appears that there hasn't been a decision on the 4 million Ghana cedi debt, which is hanging on the neck of the renal unit. So it appears there hasn't been a proper decision on that. That is why it's appearing that the people are not willing to open the unit as we speak now. It hasn't been confirmed, but that is the information I've been taking on the ground since I came this morning.
Talk about that though. What's been the reaction? Because I do understand that some patients at least have tried today, based on the directive by the health minister, to try and access the center. What's been their challenge?
Okay, yes. So since I came, there have been some patients struggling in trying to access the service, but I spoke to some of them, and the information they gave me was that they were not treated. And for that matter, one of them, who is scheduled to have a session today, how to find a different facility to undertake the session. There was also one person who reported today that because the unit has not been open to the OPD yet, the person, as I spoke to in the morning, had not been treated. So that is what is happening. So we have people coming in and out, but because the unit hasn't been opened, they've not been treated, they've not had their sessions yet.
And one more time, what exact period are we expecting the hospital to make a statement on this? Because we're picking up information that something might happen in terms of a briefing.
So that is the exact reason why I've been here since morning. In fact, there hasn't been a confirmation of the time. What I've been thinking is that unless the person whom they are refusing to mention gives the approval, they cannot go ahead with the announcement. Although they are saying all preparations have been made for the announcement, but it's left with the approval from those in higher authorities to okay the statement to be made. But because the person has not given that approval, that is why the place is still under lock and key now. So we cannot confirm when exactly they are going to open the unit. Since I came here this morning, that's what I've been thinking. Even the people I've been speaking to, they themselves, they're not even sure as to when they are going to get the unit opened.
Very trying times indeed. Kwarting, be good, be safe, and of course we'll speak to you again just to get some updates when the management of the facility is willing to do so. Let's get more from the renal patients because they are still mounting pressure on government to act on this matter. And fortunately, Kujubanfo Ahinkra, who's the president of the association, is joining us. Again, I don't like to do this very often, knowing your condition. I just don't feel okay doing this. But we still need to press home that demand that they need to open the facility.
Sure. Okay, just about an hour ago,
Right.
I had a call from the unit.
Okay.
But I don't know whether because I'm the president, I'm speaking, that is why they're called, because the rest of the people have not been called. I was called trying to find out, because some people have made a decision that maybe they might not go back to Kolebu, wherever they are, they will stay there.
Right.
So I was called, and they told me, will I like to return back to Kolebu? I said, sure, why not? Okay, so they told me that the price is $380 if I'm coming. I said, no problem. And they said, okay, then I need to do my labs and bring it back.
Right.
So just an hour ago, but the rest of my people, nobody has been called yet. So I don't know whether this is just to cover up or whatever it might be. Because so far, I'm the only person who have received a call from a senior nurse from the unit, called me, asked me these questions, and I confirmed to him.
Right.
So I put it on our page that I have got the call. So has anybody else
got,
and nobody has
nobody
responded.
And that's still, suggestive of the fact that, indeed what we're reporting is indeed the case that partially the place has been closed.
Yes, since from morning. Some of my people are supposed to dialyze on Monday. Like I said the other time, normally there's a schedule. We are many, about 250. So and we have about 15 machines. It cannot contain us. So there's a schedule. So normally what they do, like tomorrow those will be going, they'll be called today.
Oh.
And they'll give them time. Report this time, report this time. So that is the schedule.
So it's almost always a very tidy process because everyone is scheduled.
Yes.
And you book an appointment.
Yes.
So it's not as though you all flood this entire at one time.
They've been categorized. So Monday people, Tuesday people, Wednesday people, Thursday people. It's only Saturday they don't work. Then Sunday. So everybody has got his time and when he's supposed to report at the unit and go for a session. So if you claim it's open and then you've not called me, I have received the call. I have received the call just about an hour ago. Because this morning I went through there. And still, they were doing the same thing, the OP, the emergencies and then the ward cases. So, but when I cross-check again, I was being told that they are now trying to find out the people who will return back, they will do a new schedule and all those things. So they were saying probably by Wednesday, they will start operation fully.
Okay, so this might be a precursor to the main reopening, which means that everyone will be scheduled. But you're still pointing out to us that for now, they haven't called your members.
No, they've not called anybody. Nobody has contacted me to tell me. I put it on the page, and nobody is telling me that they've called. But I have received a call that will I like to
something else will be done, and that more people.
Well, in fact, the statement was this week they will open. So I insisted when this week, so that when I'm talking, I know what I'm saying.
Okay.
And they say they are looking at by Wednesday. They want to take today, tomorrow to do all the necessary thing. So by Wednesday going, it will be started. That's what it is.
But for those who do not see the picture that we're trying to paint here, let's try and emphasize that point again as to why this facility we're talking about at the Kolebu Teaching Hospital is so crucial to saving more lives.
Yeah, so crucial. Because once again, I keep saying the kind of treatment that they give is one of the best you get. The kind of machines that we have at the dialysis unit. When you take Physionos product, that is the current version that we have. So anybody who understands dialysis, when you go on the machine, you could see the clearance has been very good.
Right.
So it's very crucial, very, very, very crucial to our health.
The conversation around costs, we still have to go back there because it's not out of the way. Even if the facility is reopened, you're faced with that challenge again.
Sure.
How do we go about that, dealing with that?
Okay, like I keep saying, we have to start from somewhere to somewhere, So now they say, in fact, once again, they made me understood that they are taking the old price. That's the 380.
Yeah.
Good. So the 380 was a challenge. Because First Sky was doing the payment.
Taking care of the subsidies, right?
Yes. First Sky was doing it totally for about 200 and something patients. First Sky was doing it.
Right.
All that you need, they call you go for. So now we don't even know whether First Sky is still doing it. But per my checks, I learned First Sky is still doing it, but it's not confirmed, so I don't even know. So going back, 380, still there will be challenge. There will be big challenge because I keep telling you, sometimes I wish this conversation does not end here, so that sometimes you walk in, somebody might even come, he finishes, he doesn't even got transportation.
Yeah.
maybe ourselves, take 5, 10, they'll give it to the person. So cost, like I said, is a big problem.
Yeah.
So that's why we're saying that the government should look at the tax component on those consumables. Because as we talk now, I don't know how stock Kolebu is. Because per our investigation, I learned they were airlifted, small amount. So if they are going to open, as they claim, to full capacity, my brother, and they don't do something about it, less than 1 month, they'll close the unit down.
I see. That's somewhere we do not want to get to. But even on the cost, would you prefer the facility open with a higher cost, or we keep it shut, get ourselves ready for subsidies, and then we open it?
We can do something.
Okay.
They should open it. We can do something. Now they say they want to open course of the week. At least some lives will be saved. We should do whilst we plan towards it. But like I said, the last time we were here, Dr. Nsia Sassari sat here and promised that they will pay that 400 million that they are with. Has the money been paid per our checks? I learned that if the money is paid, the consumables more will be bought. Yes. So if the money is paid, why then they shouldn't bring the consumables in? Yeah. So they should open. Let's do something. It's difficult, but at 380 at least, if somebody comes to you, at least you can maybe squeeze maybe 100. You can get 100 or something, put it together and go and do it. So it's better. And once again, the clearance is very good with the machines that they have and the kind of system they have there. At least if one person is even doing once a week with that machines, it's better.
Let's talk about the way forward and what your members are looking forward to. You've spoken to them prior to coming on air. What sense do you get from them in terms of the kind of intervention they're expecting from government on this?
I will quote Dr. Nsia Sassari Kolebu, CEO. He's saying even if they charge the 380, the government is supposed to pay about 900 something to support. If not, that they will still come down. Yeah. So we are begging them. If now they've agreed that we should open it, then I'm sure that means that 900 will be coming. They shouldn't do us 419. That will go maybe a week, the place will be closed again. So we are just begging them. But what they just made us understood earlier, because I'm not here to defend anybody, but the Kolebu CEO said it categorically clear. If they reopen, the 4 million is paid, and that subsidy does not come, the unit
the debt will pile.
Yes, the unit will close. So I'm sure they've put in everything in place. That is why they are opening the unit now. I'm very sure that if not that, then please, we beg them, they should do all those things. But they should open the unit. Yeah. They should really open it. Because, like I tell you, somebody is sitting there. I mean, one of the patients called me today. Mr. Angra, please, can you give me 200? I don't have. Yeah. I'm also thinking about myself.
Yes.
So I don't even have. Such a person, I don't know whether he's alive now or is dead. You don't even know. But at least if somebody is helping you 380, it's quite reasonable. Yeah. It's quite reasonable.
Makes a lot of sense.
Yes. So we beg them. They should look at it for us.
Kojo, we need to go. But one more time, let me give you that opportunity to send the message across to benevolent organizations and also the authorities, because we need to keep our eyes on them. What is the message from the Renal Patients Association, and what would you like to share with the rest of the world?
Yes. I always say 3 things. Government should look at the tax component on the consumables. The reason why I keep saying this is that Kolebu has only 15 machines. We have those on the admission, normally about 100 plus. OPD, about 250. These 15 machines cannot contain us. Now, if it continues, the machines work constantly and it doesn't rest, it will break down. Where do we go from here? The private sectors are doing well because they are also trying to give services to people. Because all the private sectors, they have their patients, normally about 20. Now, you say Kolebu should take 380. Any sensible person will come to Kolebu. So there'll be more pressure on it. So they should look at it and take the tax component out so that the private sector can also come down to the 380 or maybe something. So that those who does not want to go to Kolebu can easily go there simple and have a session. Yeah. Secondly, we beg, I keep saying the churches, the big men, we beg them. If they want us to write to them officially, we'll write. We have an account. We want to put it together. They should put something in it for us. Because, my brother, it's not only about the dialysis. Right. When your fistula spoil, you are going to do is 7,000. When your neckline spoil, you are going to do is about 4,000 plus. Right. The medication, it tells a lot. And people cannot pay. So we are still begging them. They should come to our aid. Government, come to our aid. The big men around, we beg all of them, they should come to our aid. We need their help.
And that's the call from the renal patients. Of course, sending that message across is Kojo Ahinkran, President of the association. So you can just either reach out to Joy News, we'll get you through to them, or you can just get in touch with them. They would also be very willing to have your support on board. But we're keeping our eyes on the Korle Bu Teaching Hospital. It's expected that later in the day there might be a press briefing on this matter. We'll bring you some updates as and when we have them. But Kojo, thank you so much for spending some time with us.